When Sarah or one of her kids gets sick, she can't afford to lose any time.
Skip the walk-in wait room, click on your computer instead, and within minutes you can be communicating with a doctor somewhere in Canada. That's the promise of half a dozen new virtual clinics.
We are exploding. We have about 27 medical providers, and we're scaling up all the time because of demand.
In most cases, the doctors are Canadian and work in the public system, but do paid virtual visits on the side via audio, video, or instant messaging. And since one-off online consultations usually are not covered by the provinces, private companies see a business opportunity.
It's an Uber model. So what happens is the doctors are billing the patient, but we are the facilitator. So we do all of the payment processing, and for that we charge a small fee to the doctor for providing them the platform to see the patient.
Some employee insurance plans do cover private options like this. Either way, some see the idea of paying for basic health care as problematic.
We have to understand that this is a breach in the universality principle of the healthcare system, because in most of these applications you have to pay to have access to the service.
Virtual doctors are popular in the US, and in January, the public system in Britain signed on. But unless that happens in Canada, critics say dealing with doctors in both the private and public systems leaves patient records incomplete and could hurt their ongoing care.
Just because you can access something quickly and get a prescription faster and get care faster, it's not necessarily a good thing. We need to make sure that it actually does benefit the patient and make sense within the system.
British Columbia's health plan has already agreed to reimburse doctors for virtual visits, but only for people who are their existing patients. Providers of these services say it's only a matter of time before other provinces do the same. Vic Adopia, CBC News, Toronto.